2012, the federal government of Nigeria initiated the Saving 1 Million Lives program in 13 states. In 2015, it was rebranded as SOMLP4R and scaled up to the remaining 23 states, including the FCT. The World Bank approved $500 million credit for the program to the Federal Ministry of Health, who then gave $1.5 million to each of the 36 states and the Federal Capital Territory.
Lagos is very committed to delivering universal health coverage. It's an intrinsic part of Governor Babajide Sanwo-Olu's mandate. As you know from themes, the emphasis is on primary health care, universal health coverage, and creating safety nets for much of Lagosians who are close to or on the border of being considered underprivileged. So the SOML program, which stands for Saving 1 Million Lives, is a federal government initiative that's supposed to help states improve on their ability to deliver universal health coverage across majority of the health parameters that people in Lagos, in things like immunization, protection against malaria, family planning, and nutrition. So these are very important indices and parameters that we must pay attention to, and you get a lot of mileage out of delivering these kind of resources to the masses of Lagos.
Saving 1 Million Lives is a program that's aimed at improving health outcomes amongst the residents of Lagos State. It has several components: the nutrition component, the maternal health component, neonatal health component, malaria, HIV, just generally dealing with improving outcomes and reducing disease prevalence in Lagos.
As you must know, we have an appalling indices of newborn mortality and maternal mortality. So any homegrown strategy or project that aims at improving some of these scores, I think is a plus for the whole society. When you look at the design of the program itself, it's a little bit different from other ones in the sense that disbursements from the federal government is linked to results, and the way and manner each of these elements are assessed makes you qualify for the next disbursement, so it's a little bit competitive.
It's an initiative that does not involve reinventing the wheel, targeted at identifying the gaps, the funding gaps that we have, and trying to plug those funding gaps to be able to achieve our aims and objectives in terms of reducing maternal and child health mortality rates.
Better don't land for mama and pikin, no. Now free child and maternal health care. Now Saving 1 Million Lives program for results. Now SOMLP4R bring this better on. Them can join hand with Lagos State government for reduce the death of mama and newborn, no. Plus small picking them to enjoy correct health care. Now SOMLP4R bring this better on.
Consequently, the Lagos State government, through the Ministry of Health, set up a committee for the implementation of the objective of the program, which focuses primarily on results so that the state can benefit from the rewards which are based on their performance in increasing utilizations of maternal and child health interventions.
SOMLP4R for short has a program implementation manual, which every state is guided by this manual, and statutorily, each state is supposed to come up with a steering committee chaired by the Honorable Commissioner for Health. In the absence of the Honorable Commissioner for Health, is chaired by the Permanent Secretary Health.
There were committees that had to sit together with stakeholders to develop the work plans for what needed to be achieved. And that has to be based on baselines for all these things. Baselines are the levels of what these things are currently, and then you determine where you want them to go. So you identify what your indicators are, the things you want to measure, and then you identify what your targets are, where you want to take them. And you sit with key stakeholders to determine what you want to address, where you want to take those things, and what levels you want them to reach.
And you also have other members of the committee, the Permanent Secretary, Primary Health Care Board, the Permanent Secretary, Health Service Commission, Directors of Programs in the Ministry as well as Primary Health Care Board, as well as partners, developing partners that their focus is on improving maternal and child health indices. Also, we have representatives from Ministry of Economic Planning and Budget. They are also represented at this steering committee.
Saving a Million Life program is a program that set out to strengthen the health program, especially in the areas of nutrition, in the areas of reproductive health, and early child development. And all of that forms a very integral part of our health program under the themes agenda.
And the essence of the steering committee basically is to address, basically look at what can be done better. Decisions are taken at steering committee meeting.
Then we have the technical working group headed by the permanent secretary of the PAC board and PS Ministry of Health. Then the directors are members of the technical working group.
Decisions that are taken as regards coming up with a work plan, issues relating to the implementation of Saving 1 Million Lives program for results are addressed at the technical consultative group. So we have an organogram in which the technical consultative group reports to the steering committee, and it's at the steering committee that final decision is actually taken towards implementation to achieve the desired outcome of Saving 1 Million Lives program for results.
Amongst other cascaded objectives, the committee was charged with a mandate to catalyze change in the way health business is done by focusing on results and governance, to increase the utilization and quality of high-impact reproductive child health and nutrition interventions. Furthermore, the state will earn more earnings based on a set of disbursement-linked indicators called DLI.
There are 5 of these disbursement-linked indicators. DLI 1 speaks to quantity of service. The quantity of service basically address the nutrition service, the immunization, elimination of mother-to-child transmission of HIV/AIDS, improving skilled birth delivery, as well as family planning. DLI 2 speaks to quality of services. That's the quality of services that is being rendered, most especially at our primary healthcare centers, because the main focus of the program is to strengthen primary healthcare service delivery. DLI 3 speaks to improving data quality, that is improving our monitoring and evaluation. What are those things we need to do to improve the quality, the data that is being generated in each state, so that this data will inform policy decision making to improve maternal and child health indices. DLI 4 speaks to private sector engagement, and this involves collaboration with the private sector, that is the public-private partnership. DLI 5 speaks to transparency in primary healthcare budgeting. What this means is they want each state to be able to account for primary healthcare budgets in the states. Now, each set of these DLIs basically has a certain sum of fund that is allotted to it. And the assessment of Saving 1 Million Lives program for results is based on SMART survey. And the SMART 2015 was used as a baseline. Thereafter, on an annual basis, they do an evaluation of all the 36 states. So based on your improvements on this set of DLIs determines the additional funding that will be allotted to each of the states. That's why it's a performance-based financing program.
However, based on the activities of the committee over the years, one major area the state has achieved so much success is the provision of Lagos State Health Insurance Scheme.
Something that's very important for the Lagos State government, particularly Mr. Governor, is trying to provide health insurance cover for people in Lagos that cannot afford to pay for themselves. It is because of that there is a requirement in the law to set up what we call an equity fund to be able to pay for those who cannot make this payment on their behalf. So SOML was our first foray into attempting to provide care for people that cannot do that.
You remember that the vulnerable groups are mostly women and children, which is the focus of Saving 1 Million Lives program for results. So Lagos State Health Insurance Scheme and Saving 1 Million Lives program for results actually aligns in that stance. And the reason is you're trying to bring healthcare delivery to the doorstep of people, especially the vulnerable group, at the grassroots, such that they're able to access care at no cost, and then premiums are actually paid from Saving 1 Million Lives program for results.
Right now, I believe we have almost about 14,000 lives spread across 4 local governments in Lagos State. So we are providing access to care in Agege local government, Lagos mainland, Ajeromi, Felodu, as well as Ikorodu. These are people that ordinarily would suffer serious impoverishment if there was an episode of illness in their families.
We are a city, a state of over 22 million people. We have a lot of slums in the state, a lot of poor people in the state. Our household survey indicates that about 72% of our people are poor and vulnerable. And therefore, to ensure that we continue to remain at the cutting edge, we continue to support and collaborate with programs like this.
The Yoruba people have a saying there that Malu ti o niru, Olorun lo nba le shinsin. These slums are areas where the Malus that don't have Iru exist, and someone needs to take care of them. They cannot put together enough money themselves to pay for health insurance. And yet, because of the conditions under which they live in, they're one of the ones most prone to illnesses, even worm infestations, poor nutrition, issues like malaria, because with slums comes a lot of mosquitoes and stuff. So all those things, they have the highest incidence of disease and illness, and yet they're the ones least able to afford it.
In fact, we didn't settle out to do that in Makoko. It was by the time we were presenting our proposal to the commissioner then, Dr. Idris, that said, look, I'm interested in Makoko. Each time I see Makoko, I'm not happy. That can we just shift our face? He said, don't worry, sir. If that's the focus, I think Makoko is a big slum. Everybody sees it when you move from Lagos to the Lagos mainland to the island. We said, no worry, we'll settle for that. That was how we jointly agreed. We also felt that let's try Makoko.
Akọ̀wálé náà ni wọ́n wá bá wa lé ńjọ́ náà wípé àwọn Lagos State ní pé ká ṣe káàdì yìí o. Àwọn èèyàn wá bẹ̀ mú èmi á ṣe o lẹ́yìn tí a dẹ̀ ṣe tán. Ìgbà tí mẹ́sẹ̀jì yẹn máa jáde, ó wá jáde sórí fóònù mi wípé ká wá sí health center ní Ave Road health center. So òun ni mo fi wá síbí. So àtìgbà tí mo dẹ̀ ti wá síbí wọ́n dá mi lóhùn. Wọn ò ṣe bí pé nǹkan ọ̀fẹ́ là ń lò gan. Nígbà tí ara ọmọ mi ṣe mí lórí akọ́násó òyà tí mo gbé wá bí, tán ni ó fẹ́ ṣe àní listing. Gbogbo test tí mo ṣe mi ìsanwó kankan. I run several tests. Mi ìsanwó kankan. Even gbọ̀ngbà tó dé stage kan wọ́n tún dictate pé ó ní ikọ́. So wọ́n tún ní kí n ṣe x-ray fún ikọ́ yẹn.
Lagos State 71 million lives came to our community at Makoko. So they told us about the program and got us registered. Then when I was pregnant for my baby, I came to this hospital because it was the hospital that I used. I came to the hospital and they confirmed that it's true and it's a free skill, a free health skill. So from the day one of my conception down to my delivery, I paid nothing. So everything about the service was free.
Ètò tó dáa ni, ètò tó rẹwà ni. Mo dẹ̀ jàǹfààní nípasẹ̀ ọmọ mi Abdullahi tí mo gbé dání. Ibẹ̀ ni mo bí, true ibẹ̀ mo fi bí, pẹ̀lú CS ni mo fi bí. Nígbà tí mo dé cottage, ìyẹn hospital tí wọ́n refer wá sí Kàlọ́, ìyẹn cottage medical center. Mo gbà kankan lọ́wọ́ wa, oògùn, everything, test, scan, ọ̀fẹ́ ni wọ́n ṣe fún ọgbà kọ́bọ̀ lọ́wọ́ wa. Wọ́n dẹ̀ ṣe wá dáadáa, wọn ò ṣe bákan sí wa.
Ọjọ́ kan náà ni a wà nílé. Àwọn èèyàn wà níbí báyìí náà láti register láti ṣe gbogbo ẹ̀. Mo tiẹ̀ ti sọ pé mo ní lóyún kankan tẹ́lẹ̀ torí ó easy láti kí èèyàn lówó hospital gbogbo ẹ̀ kò easy, kò sówó. Àtọ́lọ́run dẹ̀ wá ṣe pé mo wá lóyún. Ìwé mi yẹn kò tiẹ̀ tètè jáde, ìgbà tó wá jáde mo wá sọ fún àwọn àǹtí mi pé kí wọ́n mú mi lọ síbẹ̀. Ìgbà tán dẹ̀ wá mú mi lọ síbẹ̀ tájọ lọ. Wọ́n wò mí, wọ́n ní máa ṣe scan kán tó máa fún mi lábẹ́rẹ́. Mo wá síbẹ̀, wọ́n wò mí, wọ́n rí àwọn ọmọ mi, mo wà okay, wọ́n fún mi lábẹ́rẹ́, wọ́n fún mi lóògùn. Ìgbà tán wá fún mi gbogbo ọ̀sẹ̀ méjì, wọ́n wá ní kí n máa wá, káwọn máa wò mí. Mo máa ń lọ, wọ́n máa ń fún mi lábẹ́rẹ́, wọ́n máa ń fún mi lóògùn, wọ́n máa ń tọ́jú mi dáadáa.
Wọ́n wá ní cottage ní orúkọ tí wá jáde sí. A wá lọ sí cottage health care ní Ìwàyà road Oníkẹ́. Ìgbà tá a débẹ̀, wọ́n jẹ́ ká wọlé, wọ́n dá wa lóhùn dáadáa. Mo bẹ̀rẹ̀ clinic ńbẹ̀. Ìgbà tó stage tí mo ṣe scan everything níbẹ̀, wọn ò gba anything lọ́wọ́ wa. So ìgbà tó yá tí mo bímọ,
wọ́n ní máa ṣe CS àtẹ̀sí ń gbọ̀n pé à níbo la ti fẹ́ rí owó tí wọ́n fi san fún CS kí n tó fẹ́ ṣe ni ọ̀gá tó wà ń bẹ wá ní àní sanwó kan pé wọ́n kó fi àfọwọ́ sí ìwé pé fún pé 1 million lives pé wọ́n ti sanwó ìgbà tán ṣe everything tán tí wọ́n ṣe for a week la ló ń bẹ dẹ́ pé kódà wọ́n ṣe wá dáadáa ni.
bọ́n ṣe wá sàdúgbò wa tán wá fún wa ní káàdì tán sọ lọ́tún lọ́sì mi ò mọ̀ pé òótọ́ ni so mọ́kàn kí ni wọ́n ṣe ń bẹ̀ yẹn mi ò mọ̀ pé òótọ́ bọ̀ bàtán wá fún wa ní káàdì táwa náà wá lọ síbẹ̀ mo ṣẹ̀ wá rí i pé n tó ń ṣe pé ó wà okay.
An zo nan unguwar namu ne aka yi registration ɗinmu aka ce mu zo a yi hotonmu. Aka yi hotonmu za a ɗauki, muka je waje aka ɗauki hotonmu da na yara na. Can kayan a daɗe sai aka zo kuma aka kira ni a waya aka bani takarda. Aka ce mu je Cottage Hospital. To da na je Cottage Hospital ɗin an yi treat ina da kyau. Sai kuma na ba su bayanin kamar yaro na yana da kumburi yana da hainiya guda biyu shine sai suka ce za su zawo su yi min operation. Daga nan kuma suka kira da sai suka yi min aikin kuma na ji daɗin shi sosai. Kuma da na je asibitin game da kumburin da wannan hainiya ba su an shi ko sisi na ba haka na suka yi yaran nan biyu operation magani kyauta komi kyauta kuma sun mamu da kyau gaskiya kuma na ji daɗin shi alhamdulillah.
I want to thank Save 1 Million Lives because they come and rescue my life. Before they came, I have a sickness called hernia, and the sickness disturbed me a lot. Sometimes I don't used to go to school because of the sickness. And when they came, they rescued me from the sickness.
Saving 1 million, a dúpẹ́ lọ́wọ́ gidigidi fún ètò tó ń gbé kalẹ̀ fún health care insurance tó ń gbé láàrin wa ní community wa yìí. Nítorí pé nǹkan tí a rí rí òun ló ń ṣẹlẹ̀ ní táìmù yẹn torí àwọn èèyàn wa wọ́n so credit wọn pé wọ́n ṣe gan torí ìka ọ̀dọ́gba ẹni tó yẹ pé kò sówó láti lọ sí hospital ó lọ gba ìwòsàn ọ̀fẹ́ níbẹ̀ ẹni tó ń bímọ ọ̀fẹ́ níbẹ̀ pẹ̀lú àwọn ọmọ adúpẹ́ lọ́wọ́ gidigidi fún ètò tó ń gbé kalẹ̀ yìí pé wọ́n ṣe gan.
We were also able to, in the area of stillbirth delivery, to encourage mothers to come and do focused antenatal care. What do I mean by this? Focused antenatal care basically states that at least every pregnant woman must have at least 4 antenatal care before delivery. We know her mothers will go to the TBAs. So what we did as part of our strategy under SOMLP for her is to actually come up with some incentives to motivate mothers to, one, come have the antenatal care in our primary health care centers, then at the same time deliver at the facility. Because some of them will have do the antenatal care, but will still go to the TBAs. So we were able to provide some incentives for the babies that any mother that comes does the antenatal care at our primary health care centers and also delivers at our PHCs will have some form of incentives before going home.
Part of what SOML was successfully able to do was to print thousands of copies of antenatal booklets with pathographs in them so that it's not a question of looking for the patograph of the mother after delivery has taken place. And it has enhanced, if we talk about safe birth, skilled birth delivery, it has enhanced skilled birth delivery.
When we looked at the trend during that implementation, we actually piloted this in about 3 LGs, i.e. Ekpe, Ibeju, and Ikorodu, and we realized that we had an uptick of deliveries. Mothers coming because they were able to inform other mothers that come, if you go to this PHC in Ekpe, even if you come there, you deliver, before you leave the facility, you will be presented with some incentives for the baby. So that actually was a motivating factor.
So far, so good. The patronage for antenatal, family planning, health education activities has increased and improved tremendously in the Mushin local government.
We have 7 comprehensive sites, comprehensive health facilities in Ikorodu where deliveries take place. When I say delivery, as in skilled birth services, births attended to by skilled health workers. And because it's a rural local government, people have their beliefs. They tend to go to traditional birth attendants, some of them not trained. Majority of those birth attendants they patronize are really quack in that sense. They are not skilled birth attendants. They have not even received any form of training. Even though we know that the government supports, empowers some of these TBAs to do what they know, as in within their limits, and refer appropriately. So the Saving 1 Million Lives program identified our local government as one of such, and assisted by providing incentives for these mothers so that they're encouraged to come to the health facilities to do their antenatal care, and also ensure that their births take place under supervision of a skilled health worker.
Nígbà tí mo fẹ́ bímọ sí ibà, àwọn kan wà tó tẹ̀ wá bímọ, wọn ò mọ anything dání. Ọ̀pọ̀lọpọ̀ Saving 1 Million Lives tó fún wọn ní nǹkan tí wọ́n lò and everything. Tọ́lá ẹlòmíì tó bá ń bọ̀ lọ sí gbà mí, mẹ́fà wà ní sọ fún pé oṣù mẹ́sàn-án kì í bá lójijì. Bọ́ ẹlòmíì ò kì í gbàgbọ́. A ní kí ni òun ara èmi ìgbà tó máa dé ibà yìí tó máa rọ̀ṣẹ̀ dé ibà kò ní mú print dé ibà wọn ò ní kan tó máa ṣe ọ̀pọ̀lọpọ̀ ìjọba. A ṣe ètò títí kílíníìkì tó lóyún ní ọ̀fẹ́, a dẹ̀ ṣe ìgbà tí a dẹ̀ bímọ wọn ò gba owó kankan ní ọwọ́ wa, wọ́n dẹ̀ tọ́jú wa àti oògùn àti abẹ́rẹ́ gbogbo ẹ̀ ló fi tọ́jú wa.
Ìgbà tí oyún mi pé oṣù 5 tí mo mọ̀ pé mo lóyún, àbúrò mi wá sọ fún mi pé ẹsẹ̀ tàbí ìlú òun ló pé ó wà òkè, wọ́n máa ń tọ́jú èèyàn dáadáa ń bíbí ìbà ní wá nìyẹn àti bó dẹ̀ wà tọ́ test mi wọ́n ní ìṣàwọ̀ kọ̀ọ̀kan kí máa lò pé mi strong tó àti bá tí bó dẹ̀ ti ṣe mo strong kò sí ọ̀kan tó ṣe mí títí di ọjọ́ àná tọ́lọ́run fi sọ mí láyé àtàlàfíà àti bá tí mo ti wá sí ẹsẹ̀ tàyè ọ̀gbowó kankan lọ́wọ́ mi.
At least àwọn èèyàn ló direct mi wá sí bíbá yìí pé ibi báyìí ó dáa kí n lo nǹkan kan bẹ́ẹ̀ yẹn, and àtìgbà tí mo dẹ̀ ti bẹ̀rẹ̀ sí ní máa wá sí bíbá yìí mi ò regret. Wọ́n ti ń ṣe dáadáa sí mi, wọ́n attend sí mi dáadáa, and everything about it is free. Wọn ò gbowó lọ́wọ́ mi.
Formally, we treat a lot of diarrhea and vomiting because mother don't know the right food to give to their baby, or even when they know the money is not available. But with the support of SOML, all those things have changed.
Ever since I've been coming to this primary health care center, I really appreciate what they do, because normally they give women easy accessibility to family planning. You don't need to buy any of the consumables like the gloves, the spirit, even the injectables that are being used. Everything is given freely. I really appreciate what they are really doing a very good job.
But tí wọ́n ti ń polówó lórí rédíò pé ọ̀fẹ́ ni ká máa bọ̀ ní health center. Then ìgbà tí mo dé health center náà tí mo wá ṣe, wọn ò gbowó kankan lọ́wọ́ wa. Wọn ò ní ká lọ ra abẹ́rẹ́ wa, or ká lọ ra glove, or ká lọ ra spirit kankan wa. Ọ̀fẹ́ ló ṣe fún wa. Then láti ìgbà tí mi náà dẹ̀ ti ṣe, ọkàn mi balẹ̀ pé kò sí pé ìbẹ̀rù pé mo fẹ́ lóyún, ìyẹn ò sí ńbẹ̀. Then mo ṣáà free ara mi, kò sí pé ìbẹ̀rù oyún o bóyá tọkọ mi bá ti súnmọ́ mi mo máa lóyún. Ara mi náà dẹ̀ tún wà òkè, kò ṣe pé bóyá ẹ̀jẹ̀ ń rush mi no, ó wà òkè.
Wọn ò gba owó syringe lọ́wọ́ wa, so mo ń dúpẹ́ lọ́wọ́ wọn. Ìgbà tí mo jẹ̀ wá sí ìbà yìí, so wọ́n take care wa dáadáa, wọ́n attend sí wa dáadáa. So mo ní láti sọ fún àwọn tó kù lóyún àwọn abiyamọ náà pé ká má bẹ̀rù láti wá. So àwọn tó ń bẹ̀rù pé bóyá ó máa gba owó abẹ́rẹ́, ó máa gba owó syringe náà, kó má bẹ̀rù.
Under the current administration, a lot has been achieved with regard to the disbursement-linked indicators. On July 27, 2018, Lagos State was adjudged the best performing state in immunization in the year 2016-2017, and this earned the state an award by the Vice President of the Federal Republic of Nigeria.
We find out that in Lagos, a lot of times people may be busy and you have to catch them on the run. When you have these outreaches, you place them at points where you have a lot of footfall. When the women get to the outreaches with their immunization cards, they know the days you are coming, they know where you are going to be. So they come quickly on their way to their various ventures, offices, businesses, get the immunization for the child, we record, and then the mother goes. So that increased our immunization coverage as well. And in fact, Lagos State had the highest immunization coverage in the 2019 fiscal year.
The indicator the SML picked is the first indicator for PMTC.
The first thing you want to do is you want to test all pregnant women. It's right now a prerequisite in Nigeria. It's a prerequisite in all countries because it gives you an opportunity to be able to know the mothers that are positive from the mothers that are not positive and provide prevention treatments to those mothers that are positive, hereby having the HIV-exposed infants' ability and chances of coming out HIV negative.
So for those women that tested positive during that activity, they were able to be referred to the prevention of mother-to-child transmission sites, because the mother actually decides which site she wants to go to. She might say, oh, I will go to a PHC near me that offer PMTCT services. She could actually say, oh, I'm doing a general hospital. So we were able to actually capture those women at those TBA sites. They were tested. For those that were positive, they had mentor mothers. These mentor mothers actually follow them through to ensure that they get the best of care.
With a huge challenge faced daily by the state in the area of health provision, it is safe to say that Lagos State government is at the forefront of performance and great results as expected in the implementation of the SOML P4R initiative in Nigeria. Ìgbéga ìpínlẹ̀ Èkó ó ti di àjùmọ̀ṣe.